So what are baggy eyes? So if you have lot of fat under your lower eyelids, so there is lot of puffiness, so it is called the baggy eyes. So the treatment is always surgical. It is called blepharoplasty surgery. So it is always done by plastic surgeons who are trained in the facial cosmetic surgery. I am Dr. Vikas Gavri. I welcome you to my practice with the name of Kaira Aesthetic Clinic in Ludhiana. So this is the cause for lot of disfigurement below the eyes. So usually this fat is behind the eyeball or behind the globe, but due to weakness of some septal layers, it comes down in front of the eyes. So the surgery is very straightforward. So we give a very small cut just below the eyelashes. This is hardly visible and we remove the fat and the loose skin, which is the cause of the baggy eyes, and the results are permanent. So all our clients, they are always happy with this surgery because there is a remarkable difference in the look of the patient. So all our patients are happy, but over few days. So you have to be patient for 2 to 3 weeks because initially there will be some swelling and bruising. So you can do all the normal activities at home. You can wear the sunglasses, you can move around, because the swelling and bruising, it takes around 15 days to completely resolve, and we take the final pictures, that is before and after pictures, at the time of 6 weeks, that is 1.5 months. So at that time you are very presentable, the pictures are beautiful, and the results are permanent. So what are the complications of the surgery? So if your doctor is not well versed with the technicality of the surgery, so there can be infection, there can be dehiscence of the wound, there can be hematoma, or there can be unpleasing outcome. So there can be discrepancy between the both eyes, and the most important and the complication to understand is ectropion. So they can be pulled down, the lower eyelid will be pulled down, so that is called the ectropion. But over the years I have been doing these surgeries for a very long time. I am nationally and internationally trained for this procedure, and we are confident because we have got the skillful hands and the experience to get the beautiful and amazing results which should look like a natural results. So I welcome you to my clinic. So how you can approach us, because we get many calls for these problems, we always advise to send us your pictures of the face from front and the sides in our WhatsApp numbers. So one of the junior doctors will call you and explain you about the procedure. Then I talk personally to the clients if they are from the very far off places, or the best is to come to the clinic so I can push the globe, I can see whether there is a actual herniation of the fat or there is a puffiness due to some fluid accumulation. So there are some clinical tests to be done, but we can tell you most of the things over a telephonic conversation if you are from a very far off place. And how to plan for the surgery? So there is no special requirements. You can book the date of the surgery. The procedure is done under local anesthesia. So we give a very small injection. So all the area will be numb. It takes me around 1 hour for the one side, 2 hours for the both sides, and we send you home immediately after the surgery. You have to show me after 2 days, then after 1 week for the suture removal. And there is a very small cut, it is hardly 2 millimeter below the eyelashes, and the healing is very good and the scar is hardly visible over few weeks. So what are the alternative treatments if you don't want to get the surgery done and you have minimal puffiness of the eyes? So we have got the non-surgical procedures also. So first is the aquatite. So that is again to be done by the plastic surgeons. So it is a minimally invasive procedure. So there is a probe which goes inside and melts the fat and do the skin tightening. So this is again a slightly invasive procedure. If you want a non-invasive procedure, it is the Morpheus 8. So Morpheus 8, we can there are pins or the needles which go inside and it will hit the fat. we can adjust the depth of the pin, so it can liquefy the fat, and it can reduce the fat. And other treatments are in the form of the camouflage. If it is the grade 1 puffiness, so we can fill the lower area, that is the tear trough or the cheek, with the derma filler, so it can camouflage your early signs of the baggy eyes. Thank you.